everyone, my name is Yusra. I am one of the UFA Next Fellow this year. We will be interviewing with Professor Okan. He is the president of UFA Advocacy Section. Thank you so much for joining us today.
Thanks for inviting me.
To start, could you please introduce yourself briefly and tell us a little bit about your background?
I work at Technical University of Munich, where I'm professor of health literacy and also head of the WHO Collaborating Center for Health Literacy. And based on the many health literacies that I just mentioned, my focus is on health literacy, of course, so we're doing a lot of research in this area and mostly pertaining children, adolescents, schools, families, and everybody involved with these settings and groups such as teachers, principals in schools. But we are also engaged with general populations, doing surveys, doing interventions, and even policy research is basically roughly what my team is engaged with.
That's great. As you mentioned a little bit, health literacy is a now essential topic in the public health area. So for someone new in this field like me, what would you suggest as a first step to start making an impact in the area of health literacy?
In order to make an impact in any area, I think the first thing to do is to engage with the concept or with the tool or with whatever approach, methodology you're working with. And health literacy is, and again, very broadly defined, is a capability, both a personal capability, but also one that's located on a system level to manage health information. And based on how you deal with health information, you use that capacity to form decisions based on these information. So I think when people understand health literacy like that, there are many ways on how to engage with health literacy. You can, for example, have a look, how is health literacy looking like in a certain population? I gave the example of schools, of children. Imagine you have secondary schools, students 10 to 18, 19 years old. You have an entire school ecosystem with the principals, with the other educational and health staff, maybe school nurses working there. You have school principals, and to some degree you have also parent involvement, right? You have this entire the social and physical infrastructure, and also the environment around the school with which the school interacts, could be the school administration, the ministries, or other health and health systems. So you can have a look, what is the health literacy in that ecosystem? How does it look like? What are the levels? What are the needs? What are the demands? What are the challenges? You can generate some evidence and learn about these things. And then the second step, you can start developing interventions to promote, to enhance health literacy. You might probably have learned when you did the first step, oh, it is the children, the students 11 to 13, boys and girls both, that have the most need. Or you could have learned, oh, it's the teachers. They need some support to address health topics, to teach health literacy in school. Or you might have learned, we have a school principal who is kind of the CEO of the school, so the boss, and he's not interested in health, and therefore in this school health is not addressed. So maybe we raise awareness for health literacy in that particular person, and then in his capacity, in his professional capacity, being the CEO, he makes sure health is a topic. So these are the things you learn in the first step, and in the second step, you can develop interventions for health literacy. So I think that would be a particularly good step, but of course this is just my perspective, and there are many ways of engaging with health literacy and making an impact, and also depending on where you work. Is it research, is it practice, is it policies, and all these three levels you can have a different impact in terms of acting on health literacy.
So that was very insightful. Thank you so much. My other question would be about the health literacy section of UFA. So what opportunities are available in the section for young professionals? How would you encourage them to pursue their career in health literacy area?
Yeah. First, maybe, and that's true for all the UFA sections, everybody can become a member. So we have on the website, there is a join the network button. You follow that link behind the button, share your email, and then that moment you are a member of the section. And particularly engage young researchers there by Barely all the young members are invited to join, and we have, for example, a steering group, and in that steering group we're trying to balancing out between experience and early career researchers. Just recently we had a call for steering group members, only for early career researchers, and we had 2 before, and now 2 others applied, and we confirmed and invited them to be members in our steering group. And this, as I said, is entirely what we are doing, inviting young people to take leadership positions, and this is also very well reflected in the leadership of the section itself. For example, while I am the president of the section, the vice president, who is doing equally work like I am doing, so there is no difference between president and vice president, and she is an early career researcher. You see, and I think that is very important, because at one point when I started here in another section, in the health promotion section, and became vice president, I was the early career researcher and the president was the senior. And I think that's a great model that should also be implemented, or can be implemented by all the other sections. But as I said, many ways to engage, particularly for young researchers. And at the end of the day, it's always the young researchers that bring in this enthusiasm, these motivations, this perception for new ideas that can be pursued in regard to my topic, health literacy now, but this is true for all the topics.
Thank you so much for your time. That was a great
Thank you
interview. Thank you.